Hi, I'm Dan Reznicek from Pacific Northwest Urology, and today I'm going to be discussing a Urolift after a TURP, or transurethral resection of the prostate. Today in our video, we're going to show you the before. This is the obstructed prostate before the procedure, and after. Now you can see the prostate is far more open. Many men over the years have had a transurethral resection of the prostate for lower urinary tract symptoms, or BPH, symptoms of enlarged benign prostate growth. Over time, the prostate tissue does grow back, and some men may be noticing that the effect that they had from the procedure may have worn off, and they may be starting to get the same symptoms that they were having again. Difficulty starting their stream, slow urinary stream, frequent urination, the same kind of symptoms that brought them to get the TURP in the first place. Some men have been researching options for urinary symptoms after having a TURP and have asked me about the Urolift procedure. Urolift can be a good option for these men in some situations. The benefits of the Urolift are it's far less invasive than the transurethral resection. Unlike that prior procedure that takes anywhere from 60 to 90 minutes, requires a catheter for several days, and is associated with a significant amount of blood in the urine, Urolift can be far less invasive and in some instances have very similar results. The procedure generally takes 5 to 10 minutes, sometimes can be done even under a local anesthetic here in the office. So the patient I'm referring to here is a 70-year-old male who had a TURP about 10 years ago. Over time, the prostate tissue does regrow somewhat into the prostate. This can do it somewhat irregularly. Certain lobes or balls of tissue grow back into the lumen or the middle of the prostate and cause obstruction. This particular patient had increasing symptoms the last year or two, and even went into urinary retention where he was unable to void at all. The catheter has since been removed and he has been able to urinate, but he's noticed a very slow stream, difficulty starting his stream, and he's interested in procedures to help him pee better. As we can see from this first cystoscopy, the lobes of the prostate are reapproximated, or they're pushing up against each other. This is only happening for him at the apex, or the front of the prostate. The rest of the tissue is actually fairly well open. There's not a lot of prostate regrowth in the middle of the prostate or near the bladder neck. None that appears obstructive at all. So the only tissue for him that's obstructing him is this apical tissue. This can be somewhat common, as urologists don't like to resect a lot of the tissue in this area as it gets close to the urinary sphincter. So this tissue is frequently a site of prostate regrowth. So don't mind these drawings. My iPad is broken, and so I'm stuck here with marker drawings. But if this is your typical prostate, bladder, prostate, and urethra, the urinary sphincter is down here. This part of the prostate is the apex, and this part is the base. In a TURP, or transurethral resection of the prostate, this section here, which is lined out in this picture, is removed during the TURP procedure. This leaves a much more open prostate that's less obstructive. A big open area here allows you to urinate better following the procedure. Well, as the tissue regrows, it can grow into the lumen of the prostate. Oftentimes, certain balls of tissue grow back in, and with time, can lead to additional obstruction. In this particular patient, and what's oftentimes common, is tissue that's left behind is often at the apex of the prostate. Down here, down near the urinary sphincter. We don't want to resect that tissue too much, as it could lead to urinary incontinence. So, as this tissue is the only part of his prostate that's obstructive, we have an option for Urolift. And what that does in the procedure is takes the obstruction where the two lobes are pushing against each other and opens it. Those clips then pinch open the prostate at that very specific spot that's causing obstruction. So rather than have to undergo a more invasive repeat transurethral resection of the prostate, Urolift may be a good option for some individuals. So as we start this video, first the camera gets placed into the bladder and we drain the bladder. And here comes the Urolift implant device. And pulling back into the prostate, back right next to this apical tissue here. And we're going to compress on the patient's right side, or screen left. And we're going to start to compress that tissue, compressing it laterally. And then we're going to fire the needle. And that happens right about now. So once that needle is fired, there we go. I compress the tissue a little bit more to make sure that that prostatic clip is in place. And then this is the tensioning part where we pull forward a little bit till we get to that white line. And then I compress a tiny bit more laterally here and let go of the clip. And you can see immediately that pulled that tissue far to the left and away from the urethra. The only thing I edited out here was placing the new implant device on the scope, and we're back in the urethra again. This time we're going to go on the patient's left or screen right, compressing on that same side. And once we've compressed enough, you can see that tissue pulling to the side away from the urethra. We're going to fire the needle, and then I compress a little bit more. And there's the needle being fired, compressed, and now tensioning the device, waiting till I see that white line. That tells me I'm in the exact right location, and going to deploy the urethral end piece there on the patient's left. And you say immediately there's already a wide open channel from the urethra into the bladder. You may have noticed there's also some yellow discoloration or a little piece of yellow tissue there. That's actually a little bit of uric acid. This patient has frequent uric acid stones and recently passed some uric acid stone and debris. Again, now I'm going back to the patient's right side or screen left. There's a little bit more lateral tissue here, kind of stacking these implants. So this one's going to go in and up and pull away laterally. So 2 clips on each side should be enough to really open the channel, placing these in a stacked fashion on this lateral tissue here near the apex of the prostate. You can see here the white line. I've placed it in the right spot, and that tissue is really far out of the way. He's going to have a very good result on that side. As you can see here, there's minimal bleeding during this procedure. As I pull the device back, already there's a great opening. Now, there's a little bit more tissue here on the left side, so I'm going to fire one more clip to really make sure that that tissue is held open very well laterally here. And focusing on the anterior channel for the Urolift, fire the device already, and that's it. That's the entire procedure. So the only thing edited out of that was the few seconds that it took to put the new device on the end of the camera between each clip. The entire procedure took about 5 minutes in total. You can see the part where he had the TURP before wide open, and actually where the part where he had the Urolift is already wide open. So he's going to have a great stream when he voids after the procedure and going to have a very good result. So that's it for our video today. Thank you so much for watching. Again, Daniel Reznicek with Pacific Northwest Urology Specialists. And today we highlighted a patient who had a Urolift after a TURP and another great result.